Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking through MCL injuries. That's the medial collateral ligament that runs through the knee and gives you stability. Let's get into it. So we're talking about the MCL, which is one of the major ligaments of the knee. And if you've had knee injuries before, or if you watch professional sports, you may have heard of this, people getting MCL injuries and what that means and what rehab looks like after that. But before we get into it, I want to hear from you. So comment below, have you had an MCL injury? How did the recovery and rehabilitation go? Make sure you hit the subscribe button and notification bell because we come out with so many of these podcasts and other videos that are meant to help your body.
This was actually a request that has come in and we listen to you. So if you have more requests, please send them in because this, though common, isn't super prevalent,
especially in like the general population. I feel
right.
like more people are familiar with the ACL.
Yes.
That's the one who gets all the glory and all the hate because it is probably more commonly talked about, more commonly injured, especially when we talk about major knee injuries. Mm-hmm. But I think in one of the studies we looked at, the MCL accounts for 8% yeah. of all knee injuries. So, I mean, a decent amount. And that doesn't just include ligament injuries. So something we should definitely talk about. What is the MCL? We have the four major ligaments that are always talked about in the knee. Like I mentioned, the ACL and the PCL. Those two prevent the tibia from shifting back and forth, which is the lower bone in our leg. And the MCL and the LCL, which are the medial and lateral collateral ligaments.
And so the inside and the outside.
Inside and the outside. And those give our knee kind of that inside-outside stability, the medial and lateral stability.
It's going to be common traditionally more so in sports, like when you're playing, running, going for something, but can also happen as an adult. You're chasing a child, you're playing around with a child, you're running, cutting.
Dogs are awful for knee injuries too.
Exactly.
I feel like you see videos all the time of a dog just sprinting and running into the side of someone's leg.
Yeah, exactly. So that is how the mechanism of injury typically for an MCL is that you get this valgus strain, which means that the knee someone's kind of hitting on the outside of the knee and the knee is falling in, making like an L shape. That's kind of how you can think of valgus. It's that L, that the lower leg is coming out to the side. Not necessarily being hit by the side, but you're rotating, you're turning, the foot is getting stuck and the knee is going a different way, right? And so we're getting that force on the inside of that knee to really kind of injure that MCL.
We see people all the time doing very high level movements, cutting, running, and their knee goes into valgus and it's fine. And they have no knee problems and they don't ever have knee injuries like that. But it's really when we have that uncontrolled, unstabilized movement that our knee just isn't ready to support, that our body isn't ready to support, that we might have an injury. I love bringing up the powerlifter example because they're literally lifting the heaviest weights people will put on their back in the world, and they're going into this valgus. And so it just goes to show that if we train it, if we make it strong, we can prepare the body better. And I think that's the point. And I love seeing more movement experts, movement professionals training into valgus and training the body to control in that area. And I think this would be very helpful for the average person, but also for elite athletes, because then you prepare your body for the unknown. You prepare your body for the variable world that is our performance, whether that's on a football field, basketball court, or walking your dog. So it really helps prepare us. And when we talk about MCL injuries, they tend to be graded 1 through 3, like most ligament or tendon injuries. Grade 1 is seen as more minor or a minor strain. There isn't a lot of involvement of actually like tearing or disrupting of fibers, or if there is, it's minimal. So it tends to be just an overstretching of the ligament itself, which can cause some laxity, some pain. You're not going to see as much bruising. And then this will reflect in the rehab. Then we have grade 2, which is kind of the most variable because this can extend from just, minor tearing of the ligament itself all the way to almost a full thickness tear of the ligament. And then grade 3 is full thickness tear. And
so when we're looking at really the rehab process, non-surgically speaking, we're going to be looking at grade 1 and 2. You will need surgery traditionally.
Yeah, traditionally.
A grade 3
especially
strain.
Depending on what your goals are.
Right.
If you're a person who doesn't do a lot of high intensity impact activities things that require cutting, turning, spinning.
Your dog is not going to go crazy when you're walking them.
You have a very well-trained dog on walks, unlike ours, who's like a sled dog. I've heard of people who have full thickness MCL injuries and they rehab because they're not trying to get back to playing basketball or running on trails or things like that, But in most cases, full thickness tears, surgery is going to be the better route for full rehab back to whatever participation you want.
We saw that an injured MCL can heal without treatment, but the healing process does plateau at a certain part. And then you have, just scar formation on that area, causing some different mechanical and chemical changes, which, yes, is going to happen. But again, you can live with that, like Dom said, especially if you get muscles around the area to be extremely strong to help support that stability of the knee. Now, you do have to be careful. What are you going back into? Are you going back to playing football, going back to playing sports, or are you just kind of everyday kind of rehab?
And I think it's important to talk a little bit about, just the healing of ligaments themselves, because again, this is why with a grade 3, like you said, the goal is to have a well-organized ligament with the tissues reforming and connecting in a way that provides that stability back to the knee.
Right.
And kind of the 3 stages of the tissue healing is we get that inflammation stage, which is right after injury. We get a little bit more of the local heat, swelling, pain. In severe cases are, we might have some loss of mobility. And then the proliferative phase, which starts fairly quickly after injury, but then can last, depending on the severity of injury, a significant amount of time, 3 to 6 weeks, it says here, but could be even longer depending on the type of injury you have. This is where our body gets back to work trying to start and remodel that tissue. We have angiogenesis, which is the formation of new blood cells. Our little cells in there go to work trying to take away the dead tissue of the ligament and lay down new ligamentous tissue, and the wound contraction, where when we have that stretch or that tear, the ligament tends to be lax. It'll start to tighten down or contract back to where it was. And then maturation, which
Stage
3, it says it can start anywhere from 2 to 3 weeks after injury, but last up to a year. And I would argue
that's important to know.
Yeah, I think that's important to know. And I would argue even beyond that, because our tissues are always maturing and remodeling and turning over. So if we get to a year and we're just like, okay, great, this is finally done.
Never have to worry about it again.
It's not really the reality, because all of our muscles and ligaments and tissues and tendons are remodeling. So that's where, based on the stresses and loads we put on the body, we're going to continue to train that ligament in a sense to be ready for whatever activities we want to do.
And this is again where we're looking at the rehabilitation process. So when it is just that minor MCL sprain or strain, and we're looking more at the superficial portion of that ligament, meaning that we can handle it non-operatively, right? It's when it goes into that major MCL and becomes the superficial and the deep layers within the ligament that we then have to look at, okay, is surgery going to be necessary for me for my quality of life and what I want to do? But when we're looking really in that acute stage, so you just got injured, you just got an MCL injury, you can technically go to a physical therapist and they can do some testing and kind of feel around the area, and different tests can lead us to identify that you've had an MCL strain. We cannot say necessarily the degree without getting imaging, but seeing a physical therapist first can tell you if they believe it's necessary to get imaging. And this can save you a lot of money. And I think that's important to note too. You don't always have to go and get the MRI right away, especially if you didn't have a huge accident, or you just noticed like you landed weird, you turned weird, and you felt something in your knee, but you're still able to walk. Maybe you noticed some swelling and some pain, but you can still move. Okay, go see a physical therapist first. They'll do some testing and they'll refer you, if necessary, to get an MRI or to get further imaging or to go see a physician. Otherwise, they can actually start the rehab process right away. And I think that is something to note and something that's great no matter what injury you have going on in the body. If it's not super severe, you didn't have a really, traumatic accident, you can go to a physical therapist first.
I think that's important too, just because, like you said, getting that initial eyes or more trained eyes and hands on your knee to give you that initial guidance with swelling management, with pain management, with what exercises you can safely do or things you can do, because especially with these injuries, our knee gets pretty confused, right? Our quad muscles, our big thigh muscles have more difficulty contracting because of pain or because they feel less stability in the area. So especially in the acute phase, that's one thing that a physical therapist might say right away, like, hey, just sit there on your couch or in your bed with your legs straight and start trying to activate that quad. They call them quad sets, or, quad activations. And it's basically just contracting your quad to try and really straighten that knee out and then relax. Contract, hold, and then relax. And that might just be what the physical therapist gives you and says, okay, do this for a few days, come back, let me know how it feels. And that can give us even more information on how irritable the knee is, how ready it is to move into the next phase, which would be subacute, which again, depending on grade of injury, it's hard for us to say exactly when each of these rehab phases would start.
Exactly. That's why seeing a physical therapist in person is key.
Yeah. So exercises we might do in the subacute phase is a straight leg raise. That's the next step of the quad set, where you're contracting that quad, lifting the leg straight, hamstring, quadricep, hip flexor stretches, different non-weight bearing light resistance exercises. So that's where even just sitting in a chair and doing what we call a long arc quad. I haven't thought of these phrases in a long time, not being in the clinic, but long arc quad, where you're kicking your leg straight from a bent position. And increased endurance activities, they have the example of a stationary bike, which it's not really weight bearing, so it's good for just that range of motion, getting the tissues pumping and moving through.
Then we go into more progressive within that subacute phase. So we're still kind of like in those early stages. We continue with that same kind of exercise program, but maybe we might put a little bit more resistance. So say I'm still doing non-weight bearing, but I'll put an ankle weight on my ankle as I'm doing those quad kicks before moving into more of like the functional phase. That's when we can start to do more of like, okay, let's do a little bit more mobility, stability, balance. We're going to integrate a little bit of core with some exercises and see how the entire body's kind of working together proprioceptively and how that knee is responding. Yeah. Then that's when we'll move into more of like sport specific. What is really like your goal? What are you trying to get back to? And how do we strengthen around from the whole foot to hip core complex, really, of how that's really working together with your knee to get you back prepared for what you really want to do. So that's where we still might not do complete total strength and get you all the way fully back, but we might start things like lunges and skipping and jumping, sport specific movements, dynamic functional drills, before really going into the maintenance phase that can go up to a year with a physical therapist, where you're working more on strengthening, more on proprioception, more on dynamic movement, and really taking that recovery to its fullest capacity.
During these functional and sport specific phases, different balance activities, focusing more on that form. We're not going to go straight into strengthening into that valgus position like we were talking about earlier. Right. So we do want the knee to regain a lot more, stability, but understanding, because you can have a really strong, stable knee and still not have great proprioception, and the knee will track all over the place. So one thing that we often will do is, like, we call it a 6-way heel tap, where you're standing on one leg and you tap the opposite foot in front, to the side, to the other side, behind, and then kind of rotate around on your knee and back on your knee, and just focus on what that stance leg knee is doing. Does the knee track forward kind of right over the middle of the foot towards the second and third toe each time, or does it like to wobble back and forth? And as you do exercises like that more consistently, you'll probably notice, okay, I'm getting the knee to track a little bit better. And I think that's one thing that throughout all the phases, we really need to focus on. Do I have control of that knee? And if it is going into a valgus position, is that intentional? And is that supported in a way that I can handle if I get back on a running trail or on the court field or wherever?
In early rehab, this is where I would say biomechanics does matter. Can you do a single leg step down without having your knee wobble in and out? Can we control from the hip down to the foot, keeping that knee in a stable line? And that's where we want to find that stability and strength. Even now, like, say you don't have an MCL injury, if you've had one, like, try that lateral step down. So you're going to stand on the side of like a step stool. Just start low. And then you're going to, trying to keep your hips pretty even, you're going to try to just slowly lower that opposite heel down to the floor without letting that knee come on the inside or outside of your foot, and seeing if you can keep those hips stable too. Like, you don't want the leg that's dropping with that hip to drop. So like, how can we use biomechanics in the beginning to create more of that stable environment prior to then moving into, okay, how do we allow those tissues to adapt in different planes of motion now? We can't just do squats and lunges going forward and backward.
Yeah.
We have to get our body used to going more side to side, single leg stability and balance. We have to do rotate and go different directions, plyometrics in different directions. That's why all of this is so important. And then starting to, go at different speeds and different rates of movement and all that kind of stuff. Ultimately, knowing that, I think it's really important that it's not bad for your knee to go outside of your ankle, right? It's not bad. We've said this in the beginning, for your knee to fall on the inside and go into valgus. It's just, how are we working into that control?
Generally, the return for an isolated MCL injury is a lot faster than a year. It could even be, even in the grade 3 instance, much shorter than that, like 6 months, 5 months, depending on how quickly you rehab back. But the point being, we always want to continue to be training and aware that, like, hey, I had this injury, I have to keep preparing my body and my knee. Well beyond one, in my opinion. If you're looking for somewhere to have a little more guidance on stuff like this, in our Gen Health platform, we have all sorts of plans that could foreseeably help with somebody who's had a past MCL injury. We have a knee plan that helps work on all sorts of restrictions from the ankle to the hip, as well as starting to load the knee, and then working into things like our full body low impact plan
or full body high intensity
plan. Those are going to help build the strength and full body mobility, as well as the high intensity plan, which starts working into the jumping, lateral movements, more dynamic movement. So we have that free trial link that will be down in the show notes. So you can get 7 free days. As our podcast audience, you can always use code OPTIMAL to give yourself a little extra discount on your first month or your first year. And that's about all we have on MCLs for today.
I hope you enjoyed our podcast on MCL strains and what you can do. I think it's really positive to know that you can help yourself, especially in a grade 1 and 2 tear, and that conservative treatment is so beneficial. So let us know below, have you had an MCL? What have you done? And did you have to have surgery or not? We want to hear from you.